Hi, I'm Stephanie Blank, and I'm a professor in the Department of Obstetrics, Gynecology, and Reproductive Sciences at the Icahn School of Medicine at Mount Sinai, and the Director of Gynecologic Oncology for the Mount Sinai Healthcare System, and an Associate Director in the Tisch Cancer Institute with a focus on women's cancers. Hereditary cancer is basically types of cancer that you may be more likely to get due to something in your genes. So I'll just try to say that a little bit more in a little bit more straightforward way. There are some, everyone has all the genes, but there are some genes that if you have a mutation in them, you become at higher risk for cancer. Some of the most common ones you might have heard of are BRCA1 and 2. And if you have a mutation in one or both of these genes, then you have increased risk of cancer. And you can figure out about that risk by figuring out if you have that mutation. Family history is really important, and there are a couple different elements to family history that you really need to know. And of course, the first thing, people oftentimes, ask someone if they have cancer in their family, and they'll say no, and then they start talking about their aunt with ovarian cancer, but that was their dad's sister. It's important that you know both the maternal and the paternal side of the family history. You need to know the people in the family, whether they were assigned to be male or female at birth, if they had any cancers, what they were, and the ages of diagnosis of those cancers, as well as the age of death, regardless of whether it was from cancer or not. And you also want to include in that family history people that existed or exist that don't have cancer, because it's really important. So when you get a family history, you get your family history and you can draw it out in a tree, you may notice a lot of areas where there are people that have cancers, and you can kind of trace that. If you're in a family that has very few women, then it's not it's not unexpected that there won't be a lot of ovarian cancer there. So it's really important that you know all of these things. The other thing that's important to know is if anyone had genetic testing, what those results are. So that would be something else that would be important. Some things that I would consider sort of red flags in a family history would be people getting cancer extremely young, multiple people in the family getting the same cancer, like individuals that get themselves more than one cancer, and kind of some unusual cancer. So those are some things that we look at. So a lot of people will say, well, everyone in my family has breast cancer. You draw it out, and there really are a lot of people there with breast cancer. And in that type of situation, it's really important that you know the age of diagnosis and if anyone had any genetic testing. So if you think you might be at increased risk of cancer based on your family history, it's a good thing to speak with your doctor about it, because there is counseling you can have and testing you can have to help determine if you have one of these mutations. So oftentimes you may see a genetic counselor either prior to getting the testing or afterwards, and then you can get the testing, which is generally a blood test. Sometimes it could be the swab from the inside of your cheek. But this can be sequenced, and they can and the labs can figure out if there's any kind of mutation that you have. And if you have a mutation, some of them we don't know what it means, but a lot of them we do know what it means, and we can use that information to help you sort of make a plan for how you're going to screen for or prevent cancer. I get that question a lot. Sometimes people say like, why would I want to know if I'm going to get cancer? But the reason why you want to know is because there's really a lot that you can do to help yourself. So if you had, say, a BRCA1 mutation, you know that you are at higher risk for a couple of cancers, breast and ovarian being the most common ones, also pancreatic and prostate, but somebody wouldn't be at risk for all four of those. But let's just say you are a woman and you have a BRCA1 mutation. You will start getting mammograms earlier than the average person. You will get MRIs of the breast as well. You might consider surgery to prevent cancer in the breast. You may go on medication to prevent cancer in the breast. If you have ovarian cancer, there are different things that you could do. You might go on birth control pills. Those could be helpful for diminishing the risk of ovarian cancer, or it may be important for you to know when you're planning your family, and ultimately when you're done having children, it will be a recommendation that you remove your tubes, ovaries, and I'm not going to make a recommendation here. Those are just things that you'll discuss with your doctor. So the reason why you want to know if you're at that increased risk is because you can prevent cancer. It actually gives you the tools to prevent cancer. So yeah, so for example, every person with ovarian cancer, we recommend genetic testing, and that's because we know probably 25 or so percent are actually genetic. The reasons that person would want to know about the mutation are a couple. One is because it has profound effect upon their treatment. So we use different treatments depending on if the cancer is genetic or not. Actually, it's actually even more important for prognosis, for figuring out, how somebody's going to do, for predicting things. The other thing is you can figure out about your other risks. So if you have breast cancer and you find out you have a mutation, you can then address your ovarian cancer risk. And importantly, if you have a mutation, it's important that you tell your family members. You can tell your children, and they can get tested, and they can either know they don't have the same risk as you, or if they do have the same risk, they can take measures to reduce their risk of cancer. So it is very important information. It's really exciting what one can do with, with knowing your family history, finding out if you have a mutation that predisposes you to cancer. I want to just say one thing is that most cancers are not genetic. So not having a mutation does not mean by any means you won't get cancer. We just don't know what the likelihood is. When somebody has a mutation, we know a lot more about the likelihood of their getting cancer, or maybe, the age at which they might get cancer. So it's really, I really look at, hereditary information and sort of knowing your risk of cancer as an opportunity to prevent cancer. One area that I'm sort of excited about is improving how we care for what we call previvors. Those are people that have mutations that we consider to be increased risk for cancer. So in the past, when somebody had a BRCA1 mutation, we would tell that person that you should have your tubes and ovaries out between age 35 to 40, or when you're done having children. And what that does is that, when you remove somebody's ovaries at age 35, they are in menopause 15 years earlier than they probably otherwise would be. And then they go on hormones. But some of the effects of having your ovaries at 35 can't be replicated by taking hormones. So what we know by looking at the tissue in the laboratory of people that had surgeries to reduce their risk of cancer and then would have a microscopic cancer, those cancers arose in the tubes. And that led to, among other things, the hypothesis that actually all ovarian cancer is tubal cancer. So it has been sort of speculated that removing the tubes preventatively could reduce the risk of cancer. So if you remove the tubes and leave the ovaries, the person does not go into menopause. And this is important because it's a major quality of life issue for people at increased genetic risk for cancer. We don't know, we don't have the long-term effects of just what we call this risk-reducing self-injectomy. And it's important that that's not the whole thing. There's a delayed oophorectomy. You do eventually get the ovaries out at some point. But we can't really tell people this reduces your risk of cancer by 95%, what we can do when somebody removes their tubes and ovaries. But we have a study ongoing right now, which we're excited about, where anybody with a BRCA1 mutation that's in a certain age range, and I don't mean anybody because there are some inclusion criteria, but we're having a study of looking at removing the tubes alone for now and the ovaries later versus both. I mean, and you decide what you want, but it's basically going to answer that question, and it's exciting to be able to be part of a study that can do that.